there are threats to health because of the threat of climate change. Reductions in water, our soil erosion, which doesn't allow us to grow crops. If people are hungry, then they are unhealthy. And of course, the very evidence of rodents, etc., where there are excessive stagnant waters around in a country. So it is all these factors which have led the International World Health Organization and those charged with looking at these issues to bring health on board as a major topic within the climate change dialogue. And we expect this is going to continue significantly over the next couple of months and years. And as such, more and more agencies will be moved to provide funding to assist countries like ours to help to build out a resistance towards this climate change. I like to always, probably the younger children may not understand this message too much, but certainly we the adults will. One of the things, of course, we face in Barbados is that because of our rating as a developed or developing country, we sometimes do not attract enough direct funding. We get a lot of funding for projects which are sort of intellectual, but the hands-on, going out there, debushing, for instance, we wouldn't be able to attract funding from the PAHO to do any significant debushing program. If it were so, I would be a happy camper. I would be in Christchurch South debushing almost every square foot that I could find. But what I'm saying to the international agencies, yes, that is fine, and we recognize that there's so many countries in the world which need to catch up. But at the same time, for us to maintain an acceptable level of healthy conditions in Barbados, we need to have the funding being made available to sustain our programs. So these overgrown areas lead to the presence of rodents, and of course we know what the cause is, what effect a significant population of rodents can have in the country. Of course, we need in the ministry to intensify our program of debushing, but at the same time, I think the opportunity must be taken to impress upon landowners that they have a responsibility to clear their lots, even if they're not using them to build residences as yet. It is our responsibility as landowners to clear the lots you have. I do not own a house. I own 2 small parcels of land, and both of them I make sure are cleaned almost every 2 weeks, so they're in perfect condition. Any imperfections in the one which is adjacent to the house which I live in is because my wife is an avid gardener, so she sometimes creates a lot of composting heaps and plants around the place which I have not sanctioned, but which I have no authority to do anything about anyway. So that is the reality. But no, we really have to impress upon landowners that theirs is the primary responsibility in terms of clearing the lots in the country. The government will chip in, but again, in an environment of tough economic decisions, one can understand where those priorities may sometimes not be in sync with the immediate needs of the population. So as members of Parliament, yes, we are very, very concerned. We keep agitating for funding to help us to clear these lots, but at the same time, we recognize these limitations. I want to ask our people to come on board with us in this regard. Another request I have, of course, for these posters, I don't know who owns the posters. I trust the schools or the children, maybe not the children, but the schools may own the copyright. Who owns it? Oh, the Ministry of Health, but that's good. I suppose I have some say on where they end up. But this is good news because those of you who visited the 5th floor of the Ministry of Health at any time, when you get out of the elevator, there's a large blank wall which has concerned me from the day I entered the ministry about 2 years ago. We were working with the Ministry of Culture to get hold of some. I know Denise had that painful exercise to complete, to get hold of some of their collection, art collection, and we've not been successful so far. Since Mr. Graves, we own these work of art, I would sincerely ask for with the permission of the artists, of course, the students, that we are allowed to mount these photographs on that wall with the significant messaging around it and make it a theme. It would give me no greater pleasure. That way we can take down Mr. King's notice about not eating, no drinking, no sleeping, and replace it with these great works of art, which send a health message. And I think you, the parents and the children, will be pleased to know that this work has gone to such a useful exercise.
Changes are affecting countries all over the world. Temperatures are so high in some places that it results in people getting ill and sometimes causing deaths. Long periods of heat exhaustion especially affects babies and senior citizens. It also results in droughts and fires in some areas. There are also more incidences of natural disasters worldwide, like storms, cyclones, typhoons, and floods. The spread of diseases transmitted by mosquitoes, such as malaria and dengue fever, as well as bacterial rabies, is also increasing. Some diseases can also be spread by contaminated water, dry flooding, such as cholera and typhoid. Global warming is the rise in temperature of the Earth's atmosphere. The warming atmosphere from global warming also holds more moisture, increasing the chance of extreme rainfall and flooding. Warmer temperatures and increased levels of carbon dioxide in the atmosphere help some plants to grow faster, mature earlier, or produce more potent allergens, such as poison ivy. These allergy-related illnesses are common and result in lower productivity as human beings are sick more frequently. The rising of sea levels is mainly caused by global warming as the sea expands and gets hotter, as well as the melting of glaciers. For every centimeter rise of the sea level, the beach retreats inland by 1 meter. Much of the world's population lives near the coastline. Beaches are chosen as vacation spots for tourists. So when the number of beaches reduces, so will the number of tourists. Increases in rain can cause flooding, and increases in the lack of rain can cause drought. Droughts can lead to more deserts in the world, causing the soil to become dry and unable to produce crops. This can limit the amount of land used for agriculture to feed the world's population. This means that there is less land available to grow crops and feed the world's population.
Will affect human health as a result of the climate change. I would like to commend the students and, of course, the parents and the teachers who helped them to prepare such a wonderful display. Finally, I noticed that some of the posters don't speak only of the problems, they also show solutions by suggesting to go green.